I just read an article in a magazine, and it was called the 17-year delay. And it talks about all this
Mm.
research that is going on currently in medicine
Mm-hmm.
and health by reputable labs and doctors and
Mm-hmm.
scientists. And once they prove that something is working or not working and the research is coming out, they actually shelve it for 17 years before they actually bring it to the public. So the knowledge
Mm-hmm.
about Mercury, for example, that you're talking about may already be agreed upon, but
Mm-hmm.
they're not going to do anything
Well,
for 17 years before they start probably implementing it because they cannot change the books every year. They probably have
no.
to pick and choose and say, if we're going to change these medical books, it's got to be done in a timely manner.
And they're going to introduce something else to change the priority, right? They're going to take the focus off of mercury, put it onto white fillings or something else, and then it slowly goes away. The problem slowly goes away. I mean, this is a playbook that's been going on with cigarettes, right? We know the whole story. The data was there, doubt was introduced,
Mm-hmm. Mm-hmm.
information became questionable, and then it slowly went away. People stopped smoking a little bit less. Cigarette companies bought food companies,
Mm-hmm.
and now they are, now they're doing the same thing for the foods. And now we're waking up with the foods. We're slowly starting to talk about food colorings. And oh, great, we took red out. I
Yeah.
mean, it's ridiculous. In the United States, things take a long time. You need to be an advocate for your own health.
Mm-hmm.
If you don't spend the time watching podcasts or YouTube channels like this, you are going to be unfortunately misled
Mm-hmm.
because doctors don't necessarily mean harm. They
Mm-hmm.
just don't know any better. And it's a business. It's a business.
I agree.
Mm-hmm.
I agree. I do believe that if we want to on that topic, then I do believe that doctors, it's very difficult to be an independent physician at this point. Now,
Mm-hmm.
dental is different. I would say you can start your own office and start and do that. But medical doctors who see patients on a regular basis, for them to do all the
Mm-hmm.
bookkeeping and everything that is needed to thrive in the business, it's almost impossible financially
Mm-hmm.
anymore to do that. And
It
you're
is.
going to be available 24 hours a day because you're like a country doctor. So most of them will go into a health center and then practice, and they say, well, these are the rules. And if you don't stick with the rules, you got to go. So they're
Yeah.
somewhat forced
Mm-hmm.
because I do believe that pretty much anybody graduating from medical school has somewhat of a brain
Mm-hmm.
and
Have
should
to,
be
yeah.
able to think for themselves.
They have good intentions. I think doctors, I mean, when you go into medicine,
Mm-hmm.
you start off with good intentions. You want to help people.
Yeah.
You follow the Hippocratic oath. You want to be a doctor. You want to heal people. And then you quickly learn that
Mm-hmm.
it turns into a business.
Yeah.
And you have children, you have a mortgage, you have a life, and it is very repetitive,
Mm-hmm.
even in dentistry. You do the same thing over and over. I can't tell you how many times I've told people to brush more and floss more, and we know you don't.
Yeah. Yeah. Yeah.
Nothing's going to change. It becomes, after 27 years, it is a business, so you have to make a choice, right? What is it that you want to stand for in a legend kind of way when you retire? Did you run a great business? Did you own 25 practices, buy a private jet, and move on that way? Or
Mm-hmm.
did you focus on every single patient,
Mm-hmm.
not place toxic materials in people's mouths, not join organizations that are going to tell you what to do, not let insurances dictate the treatment?
Mm-hmm.
Patients ask me, they used to ask me, now people come to me because they know, but they used to ask me, why is it so expensive? Why don't you take my insurance? And I would tell them, I guarantee you that the insurance dentist makes more money than me. I promise you that. But my decisions are based on what you need, not what I can do for you that's paid for.
Mm.
If I was looking at your insurance benefits, I would dictate your treatment plan around insurance benefits. And I
Interesting.
would cut the time in half. I would move real fast. I would tell you your insurance covers it. You wouldn't question it. You would do it. And then after 10, 15, 20 years, you would have a whole bunch of fillings. Then you would have some root canals, some crowns, some bridges. We pull some teeth. Eventually you get, partials or bridges or partials or implants. And then eventually maybe a denture. It is a
Oh.
cycle. And it's a wonderful cycle for the dentist.
Mm-hmm.
I always told patients a mercury filling. not a silver filling, it's more mercury. A mercury amalgam, or a silver filling as people like to call it, is a seed. I place the seed into your filling, into your mouth, into your tooth, and it expands and contracts 2 to 3 times. That's just the physics of mercury.
What do you mean it expands 2 to 3 times?
So when you drink a glass of cold water,
Yeah, it shrinks.
and then you drink a little bit of coffee, it expands and contracts. Everything does. The coefficient of expansion for mercury is 3 times as high as the outside layer of your tooth, the enamel. So your filling is doing this. What does that do to a crystal, which your tooth is? It's going to crack.
I see.
100% of the time. So every mercury filling will at some point cause a cracked tooth. A cracked tooth turns into either a crown, a cap, to hold the cracks together, more money for the dentist, or the tooth cracks in half, tooth comes out, now it's a bridge, 3 caps, 3 crowns, or an implant. It is a seed. I plant the seed, you water it with cold water and coffee for a couple of years, your tooth cracks, it gets into a bigger filling, then it turns into a crown or an onlay, something that goes over the tooth, more expensive. Then it turns into an extraction or a loss of the tooth. It's a wonderful, sequence of events for the dentist. Every single tooth is worth tens of thousands of dollars in production for a dentist. And a lot of practices think of it like that. And so when I graduated from USC, I placed 1 amalgam, 1 silver mercury filling, because I had to.
Doing the exam.
For the board.
Yeah.
So I placed that filling on my brother.
Oh, is that right? Oh, that's
I'm
good.
sorry. I'm gonna make it small. So I placed the mercury filling on him, and then the next day he came back to the practice. I took the filling out, and I put in a composite resin filling, something that doesn't leach poison. It doesn't expand and contract to break the tooth. That was the last time I ever did what's called an amalgam filling.
So,
28 some odd years ago.
wow. That's really interesting.
So the funny thing is that
So so the knowledge was out there,
it just
but it
made
wasn't
sense,
practiced.
right? It just made sense to me.
Yeah.
You don't have to watch a lot of YouTube videos or seminars to have somebody tell you something is bad. You need to use your brain. You need to think. And if you know that something is going to cause something to crack because it's incompatible,
Yeah.
why would you use it? And we're not even talking about mercury toxicity. We're talking about something that doesn't work for teeth because it cracks teeth, right? So why would I place that in a patient's mouth when I can do something that is just as easy to place,
Yeah.
costs the same amount of money for the patient,
Is
looks
that
a
right?
lot better?
The same amount of money?
I would never charge different. If it's a 1 surface filling, it's a 1 surface filling.
Okay.
If it's gold, it costs more, right? Or porcelain. But if it's done in the office, it shouldn't cost more. It should be the same procedure. So why would I do mercury fillings? There was no reason.
I do want to ask you, and you said earlier about these 3 nerve endings or pathways. What did you use?
Pain nuclei.
Pain nuclei.
Yeah.
Now, when you were practicing and you were talking about these teeth that were in a form and you would drill, how do you know how deep to go before you would hit those pain receptors?
The pain nuclei, if you touch a tooth, you feel pain. If I blow cold air on your tooth, it hurts, right?
Correct.
Yeah. So there is a connection. See, it's an organ. Let's get that
It is.
right out. It's an organ. It's not a dead piece of tooth, as people like to think. It's an organ. It's alive. It has a lymph system, it has a nervous system, and it has a blood supply, a blood system. So
Wow.
all of those are circling to the tooth with millions of little tiny canals, and each canal is filled with a cell. Those canals go from the inside of the
The
tooth.
canals are filled with a cell?
Yeah, the canals go from
Yeah.
the inside like a nerve, like a nerve arm,
okay.
right? So it goes from the inside to the outside. And inside that, so millions of them, miles of canals in your tooth. So those help you feel pain, hot, cold, and around the tooth is a ligament that makes you feel proprioception. And when you bite on something, you feel the tooth moving. That lets you know that you're biting together.
Yeah.
So it's a very complex organ. When that organ dies, meaning you cut the blood supply off on the bottom, no blood supply, it dies. So if I take your kidney and I clamp off the blood supply, the kidney
Correct.
dies.
Yeah, you
Liver
bet.
dies, right?
Yeah.
It all dies. So it's a organ with all this dead tissue inside. It's got dead cells, millions of them. It's got connection from the outside of the mouth, where you chew, where all the bacteria is, to the inside of the mouth through millions of little canals.
Correct.
It's a connection.
Correct.
And all that stuff rots. When something rots, okay, it is bacteria food.
You bet.
Bacteria food
You bet.
is a bad thing, right? Bacteria release metabolites or toxins, and those things poison you. We'll get into that in a little bit more detail.
Yeah, because if the temperature of the mouth has a certain temperature, that will, will accelerates it.
It's a great, it's the best place for bacteria to grow.
Yeah.
And they grow wherever they can. They hide, right? They want to hide from your immune system. If you were to hide from the immune system, where would you go? You go in a dead organ that has an endless food supply that cannot be reached by your immune system because it's outside the body, yet in the body at the same time.
Correct.
And around it is a ligament that now is also dying. And below it is a opening that used to be a connection into the main blood supply that now is also dead. And gravity pulls all that poison, just drips right down the bottom, out into the bottom of the tooth, into your bone, from your bone into your system. So in a way, it's leaky gut at its worst.
So, wow, that makes a lot of sense.
Now, there's
when
only,
you say it that way.
Yeah, I mean, people know when from the mouth to the bottom, it's a tube. It's a sealed tube. We need to keep the outside outside and the inside inside. When there is a break in that tube and the bad stuff gets into your body, it's called leaky gut.
Yeah,
So people
correct.
know leaky gut from their stomach.
Yeah, you bet.
They know that that's bad, right? There's so many different diets to try to repair the leaky gut.
Amazing, yeah.
But in
And
reality,
it is a cause of autoimmune diseases.
absolutely,
Yeah.
absolutely.
Yeah, I mean the leaky gut. So
Leaky
it's
gut
interesting
is.
that you now talk about the teeth.
Leaky gut starts right here.
Yeah.
So your teeth, if there's bleeding when you floss, okay, that is a direct connection from the outside to the inside, leaky gut. So periodontal disease, gum disease, leaky gut. Wisdom teeth that are infected, that are connected to the inside of the mouth, leaky gut. Root canals that are infected, leaky gut. When you have a deep pocket, right?
Correct.
5 millimeters, we like to say, that's because that's where the bad bacteria live. And as soon as you put your little instrument in that pocket around the tooth and it bleeds, now you have leaky gut and the worst bacteria getting into your system all the time. In dentistry, we protect ourselves by giving antibiotics, legal protection. Because if somebody has gum disease or if they have a heart valve problem or they had a knee replacement, we don't want the bad bacteria from your mouth getting into your system and then colonizing those parts of your body.
Yeah.
Right? So theoretically, and this has been a little bit adjusted over the last couple of years because it was ridiculous, when you give somebody antibiotics, they are now protected for a short amount of time from bacteria getting into their system. So when I work on you for 20 some odd years, the rule was give them an hour before a prebiotic, an antibiotic before treatment. Why is that? Because if anything happens, it's not my fault.
I see.
Because I was giving you antibiotics. The
Correct.
funny part is you're going to go home, you're going to brush your teeth, bleeding. You're going to floss, bleeding. You're going to have gum disease, bleeding. You're constantly leaching bacteria into your system all day long. It's not my fault.
No.
I'm just protecting myself legally from you saying it was me.
Plus, antibiotics are very limited in what they can do.
Absolutely.
They
that's a whole
don't deal
nother
with
subject, yeah.
fungi. They don't deal with viruses or parasites. They're just antibiotics. And I always say it is the shotgun approach that medicine is using for almost everything. Because you don't want to tell somebody, well, I'm going to use an antiparasitic medication on you. The people freak out. Antibiotics is like this common household word that
expect it.
everybody expects and accepts.
Yeah,
Yeah.
And it's a psychological aspect as well. If I don't give antibiotics and somebody expects it,
Yeah.
it's my fault.
Yeah.
If anything happens, it's going to be. So often we prescribe antibiotics just because you expect it, which is stupid. Literally. Because antibiotics, we know the studies, right? 1 round of antibiotics increases your chance of anxiety, loneliness, depression by over 20%.
I
for
did
12
not know
months.
that. Wow, that's
Over
interesting.
20%. And that's 1 round.
Huh.
The second round bumps at over 50%. So You wonder why people feel lonely, and they're always on social media trying to connect, right? People watch YouTube, they watch social media. Number one, because they're bored and because they're lonely. So this has a lot to do with the drugs we're giving them that are destroying their ability to recognize self. So when you give them antibiotics, they're going to feel anxiety. Anxiety is huge, right? They're going to feel loneliness, depression. Then we give them more antibiotics. Then we give them, SSRIs. We give them drugs to make them feel better,
Exactly.
which are made in your gut, right? 70% of your
Naturally,
serotonin is made in your gut.
Yeah.
We destroy the gut bacteria that makes the happy hormones.
Yeah.
You feel depressed, anxiety. We give you a supplement so that you no longer build it yourself. You let your gut be destroyed. You can no longer take care of your own chemistry, so to say. And no wonder people are all messed up. And it starts with just one round of antibiotics. And so,
That's incredible.
and that's just one drug.
Yeah,
There's
that's really
just
something.
millions of them out that do worse.
Yeah, and you look at so many young children that get on antibiotics
Ear
for whatever
infections,
reason.
tubes.
Yes. Yeah,
Well,
and so they already start behind the eight ball simply because of a treatment like that.
You are born with, I think, 287 toxic chemicals in your umbilical cord. Okay.
Huh.
So you're born with all those toxins because of the environment the mother lived in. So you are born toxic.
But they start helping you to build your immune system.
Well, these are not natural toxins.
Okay.
These are the chemical toxins.
Okay.
The things that you don't want in your body. The things that shouldn't be in a human body at all.
Okay, that's what you're talking about.
Glyphosate, things like that. But so the child is born toxic, and then it gets vitamin K, which it shouldn't have because vitamin K, I mean, it's a whole other thing. You shouldn't be using vitamin K. Your body has so many injuries from going through the birth canal. The blood needs to flow. It needs to flow to all these areas to heal. If you're going to clot it up, now the body can't heal, right? Baby
True.
can't heal. You clamp the umbilical cord, which has a significant portion of the baby's blood. It's not your blood. Baby needs that blood. Let it get into the child until it stops pulsating. You leave the umbilical cord on. I mean, there's so many things we do wrong for children that by the time they see me, they say 3 years of age, you should look at a child, right? By the time they see me, they have jaw development issues, right? Because they didn't breastfeed long enough. They didn't have the proper diet. They're all eating out of these little pouches.
Yeah, the liquid pouches.
So they have jaws don't get developed, so they don't have airway issues already. And then we got to talk about
They have
airway
suction
dentistry.
power, but they don't have
Exactly.
biting power.
And then they have habits. They push the palate up, so you get these vaulted palates with kids. And so you are starting off on the wrong foot. And then you get all these vaccines. I don't even want to get started with that. You don't. I mean, let a human being be a human being. So by the time the person is a teenager, it's a miracle we're alive at all.